A bone marrow transplant could save a life of someone with leukemia, sickle cell, or some other blood-related disease. But the marrow that patient receives must come from a genetically matched donor. Now, you could help save a life by joining the National Bone Marrow Registry. I sat down with Nancy White and Cindy Gaskins to find out how.
It's a way that people can register to be a match for patients that have a blood cancer like leukemia or lymphoma or even some sickle cell anemia.
Okay, and this week the Medical Center of Central Georgia is actually asking for folks as Middle Georgians to come out and register. Talk a little bit about the registry and why it's important.
Sure. Oh, it's very important because, again, that bone marrow transplant is the cure for many people with these diseases, and it's very difficult sometimes to find a genetic match. The more people that register, the greater the likelihood. It's important that we have a great pool of people 18 to age 44 because they have the greatest percentage of success in terms of the transplant taking.
Okay, and Cindy, you're obviously not a stranger to our show. Jay's Hope has partnered up with this. Tell us why.
Yeah, so we are a volunteer recruitment group with the National Marrow Donor Program here in the state of Georgia, and we have partnered with the Medical Center to put on this drive to find those life-saving donors in our area for families and patients here in our area.
And these patients are people with leukemia, with sickle cell, with other blood-related type diseases, right?
Right.
Okay,
right.
Nancy, tell us kind of, I'm curious, and I'm sure our folks at home are, how do you go about registering? Is it a painful process?
No.
What do you have to do?
It is so easy. It's just a cheek swab. You go in and, of course, you sign a consent that you're willing to be part of this, and they do a cheek swab, and then they put that in the national bank, the registry bank, and the chances of you getting a call to be a donor are approximately 1 in 500, something like that.
And what happens at that point? I mean, you do the cheek swab, your information is saved, and then what?
Well, again, you just wait to see if you get a call. You know, oftentimes it's the family members that want very badly to be the genetic match and make that donation, but 70% of the time they're not a genetic match. So this really is so important to increase the odds of someone having a cure, and you really never know when it might be you or a family member that's in that need.
Okay, and I might be getting ahead of myself, but say, you know, down the road you are a match for someone. What's the process at that point?
They would call you and ask if you're still willing, and if you are, it's not at an expense to you. The other insurance company typically pays for that, but you would go and prepare for the procedure. There would be some pre-treatment things, and there's just one of two ways normally that you donate. It could be through general or regional anesthesia that they put a needle in your back, or it could be like a blood transfusion type of treatment, and you don't know until that circumstance arrives which method it would be.
Okay, and Cindy, tell us about the need. I mean, we really do need people for this to sign up, to register. Talk a little bit about that.
Well, there is a huge need, and we're finding that bone marrow transplants are the cure for so many diseases, and in a lot of the studies now, I mean, even you know, elderly people are needing bone marrow transplants for different diseases. And with the kids that I work with, most of our kids that have leukemia and blood-related cancers, a lot of times their cure comes with a bone marrow transplant. And thousands of patients every day are searching the registry looking for that miracle match. And there's also a huge need for minority donors. Out of the 7 million people on the registry, less than 10% are minorities. So we have a lot of our kiddos that are waiting and searching, and you could be their hero.
And to register to become a bone marrow donor, head to the Medical Center of Central Georgia's Ambulatory Surgery Center lobby this Friday. Now, they're located at 1014 Forsyth Street in Macon, and you can go there between 7 and 10 a.m. or 3 and 6 p.m.